Hey guys, Dr. Shook here. I hope you're doing great this morning. What I want to share with you guys today is the difference between hypothyroidism, which is low thyroid function, and functional hypothyroidism. Okay, so two different terms. So hypothyroidism is going to be when you actually have a lab high TSH and you have low T4, T3. Okay, so you have, technically to be diagnosed as hypothyroid, in a medical setting, all you need is a lab high TSH. That's it, and that's all they need to diagnose you as hypothyroid and prescribe a medication. But from my perspective, it is. I look at that and I think that TSH alone is inadequate. Now, I talk about that in other videos. What I really want to highlight the difference here is that if you have you're hypothyroid, technically you're hypothyroid, you don't have enough thyroid hormone, okay, to stimulate your cells in your body, okay. That's one problem. But most people that I see in practice, and most people I think today that actually that are suffering with these thyroid related symptoms, it's not because they don't have enough thyroid hormone. It's actually because they can't use the thyroid hormone that they have properly. So that is considered functional hypothyroidism. That's a term that I use, which is just it's used to illustrate the point and explain the fact that other systems of the body can be breaking down and could be causing a problem with your body's ability to utilize the thyroid hormone that you have. So one of the things, for example, that will commonly that we'll commonly see happen. I don't want to wake anyone up this morning, so I'm keeping my eyes. I hear the floor popping and cracking a little bit, like some little feet might be walking around. So I'm trying to keep the volume down. One of the things that you'll see is that will interfere with thyroid hormone physiology very, very commonly. It's probably the most common thing that I see is just a high level of inflammation in the body. So we know if someone's autoimmune that they have a higher inflammatory load of these chemicals called cytokines. And cytokines, they're produced by the immune system. They're these chemical messengers, and what they can do is they can decrease they decrease the sensitivity of your cells of your body to your thyroid hormone. So you can have normal quantities of hormone but have decreased sensitivity to it. Okay, that's number one. It's the most common thing I see by far. Number two, you could have issues where you cannot get your thyroid hormone that's in circulation, so it could be perfectly normal levels, but you can't get it to the cells where it's needed. Now you have to have a transport protein called a thyroid binding globulin. Okay, the thyroid binding globulin is a protein that's in your blood that attaches to the thyroid hormone and carries it to the cells of the body where it needs to be used, and then it lets go of it. If you have problems where you have an estrogen dominance or a testosterone dominance, meaning your sex hormones are out of balance, it can create problems with your ability to actually use the thyroid hormone that's in your bloodstream because you can't transport it properly. Okay, so that's another thing that I see. Other issues can revolve around, in the typical medical setting, TSH is what's checked, and then a thyroid hormone is prescribed. And few people. It gets done, but it's not extremely common. More people just have TSH checked than people that have TSH plus T4 and T3. Okay, so the majority of people only get TSH checked. And what I'm really trying to get at here is you can have a problem converting T4 to T3, which is the active form of the hormone. So if you can't convert it well, then you're not going to have enough T3, which is what your body needs. Okay, and in particular, your body needs free T3, not total T3. It needs free T3 to stimulate the cells. Okay, so one of the things that can happen is that you don't convert the T4 to T3 very well. That happens in the liver and the GI tract. So if you have gut problems with your digestion, you may not be converting about 20% of your T4 to T3. If your liver is inflamed, if your liver's fatty, you have impaired liver function, you may not be converting well, okay? So we see that's a problem. We also see issues with iron deficiencies, where you can't, the conversion process that occurs in the liver of T4 to T3 is dependent upon nutrients, vitamins, minerals. Iron is one of those. It's really important. So you can see nutrient deficiencies. It's very common at the at the level of the cells in your body. Every cell, how it uses the thyroid hormone is that the thyroid hormone goes into the cell and attaches directly to the DNA of your cell and drives what we call a proteomic response. Okay, it drives the metabolism of the cell. Well, the little receptor on the DNA is sensitized only if you have enough vitamin A. So you have to have enough sensitivity to your to have sensitivity to the thyroid hormone. You can't be deficient in vitamin A. You need vitamin A. So there's all these little places where, and there's more than that, but there are all these places where the thyroid can break down, the thyroid physiology can break down, that has nothing to do with your thyroid hormone levels. Okay, so there's hypothyroidism, which is technically a high TSH. That's how it's going to get diagnosed. Okay, and then there's what I call functional hypothyroidism, which has to do with usually those people that I see, they have the quantity, they're taking medications, quantities are fine, but they still don't feel well, and that's because their physiology is breaking down somewhere else. So we've got to look at the whole person. We've got to look at all these other things that can be contributing and try to untangle this web, this mess, and make sense of it. Lay out all the pieces of what's going on. I say the pieces of the puzzle to make sense of what's happening. But anyway, I appreciate you guys. I hope you have a wonderful rest of the day. I tend to get too loud, and I don't want to wake anyone up. But I hope you guys have a wonderful rest of the day. If you have any questions, post them below. Remember, the month of September of 2016, we're offering, if you are a new patient in the office or you're a distance consulting client, where we can actually have appointments via Skype, FaceTime, or via phone, you're going to get the 6-week Hashimoto's Transformation Program as part of that first visit, completely free. That's a $495 program that you're going to get for free. Our first appointment is $250. Okay, but I'll do a very thorough, detailed review of your history. We give you a health history to complete that's very detailed, very thorough, and then I will review that prior to our appointment and have a full page of notes ready so that we can take the appointment's about 1 hour that we'll have as a distance consulting or in-office patient, and so it's about 1 hour that we'll discuss your case inside and out, and we'll see if we can't come up with some ideas on what to do next. So a lot of times I may suggest that you get labs done, but sometimes that might not be the necessary next step. It just depends on what your case dictates and what my thoughts are and what we come up with as a team to try and approach this in a way that's in your best interest, and that you can do it. So you don't always have to do testing, but testing is extremely helpful if it's within your budget to do. Okay, so if you guys need anything, just let us know. Post comments below, and we will post some links to some resources as when my staff gets a chance. Hopefully they're doing it right now. But I appreciate you guys. Hope you have a wonderful rest of the day, and I look forward to seeing you on the next live stream. Thanks.